Welcome back. You are watching a continuing coverage here from Davos 2023. I'm Shereen Bhan, and joining me now is the head of healthcare at the World Economic Forum, Shyam Bishen. Shyam, thanks very much for joining us here on CNBC-TV18. It's great to have you join us on what is turning out to be a very, very right Davos on day one itself. But Shyam, let's talk about the state of health at this point in time. The pandemic looks like it's receding, even though we've gone through a fairly difficult period in China. Sum up for us where the needle lies as far as pandemic and pandemic preparation is concerned.
Yes, first of all, thanks for having me, Shereen. As you said, we see that pandemic is receding, except for a few pockets in China and other places. But I think we have done a very good job of containing it, except for new variants that from time to time pop up. The vaccines are working. The idea here is to vaccinate as many people as possible around the globe. The challenge has been getting vaccine to everyone. So vaccine accessibility has been a problem. But I think that's improving now. I think we are getting more vaccines to people in places like Africa, in other remote places of the globe, and that's helping quite a bit. So I think you're absolutely right. The vaccine is working, and the pandemic is in recession.
Yes, and we hope that, even if there are more variants, which is likely to be the case, that we will be able to deal with this appropriately as we move forward. But, has the world learned its lessons from COVID-19? Bill Gates last year was here talking about the need for putting together a plan to deal with the next pandemic. You've, of course, been speaking with leaders, with both private sector as well as government leaders. Do you believe that there is focus on how to deal with the next pandemic? Because it seems pretty clear that we will be hit by one.
Yes.
The question is when.
Yes. Yeah, you are absolutely right. Many people say that the current pandemic or COVID-19 pandemic is only a precursor. There will be more. There may be even worse, potential to kill more people if we don't prepare well. So, as you said, we are working with the world leaders. We are working with private sector, public sector to come together to make sure that we are prepared for that. One of the areas where there is a lot of work going on is in pathogen surveillance side, where we want to make sure that there is integrated national, regional, and global system to monitor new pathogens, new variants coming through.
Where are we on that front?
So I think we have done a pretty good job working with Africa CDC to bring together data at least in Africa continent. And the idea here is to make it more robust so that private sector and public sector across the world can access the data, and also integrate it with the rest of the world. So make it more global. So as soon as there is a pathogen identified, we can come up with medical countermeasures. We can come up with diagnostics, vaccines, and treatments. So it's the beginning. I won't say that we are there yet, but I think we have made some very good progress there. So that's one area. The second area, we are working with both private and public sector, with Gavi, with WHO, with CEPI, and with many companies like Pfizer, Moderna, and others, is to make sure that there is a vaccine manufacturing in continents like Africa. Right now, only 1% of the total vaccine is made in Africa. And as you know from the last time, that's one of the learning. There was export ban. There was nationalism that kicked in as soon as the pandemic was prevalent everywhere. So people in Africa were not able to get vaccines. Yeah. Similarly, people in many other low and middle income countries where you don't have vaccine manufacturing, we had that challenge. So we want to make sure that we solve for that, and that's what we are working with these companies I mentioned, with organizations I mentioned, to make sure we establish the vaccine manufacturing in those parts of the world.
But when do you expect that to become a reality? And you're absolutely right. We saw this being a big challenge. Vaccine inequity was one of the big problems that we had to face through the course of this pandemic. But there are issues around transfer of technology, and forget that, but just being able to set up facilities in different parts of the world. Is there enough collaboration to move us realistically to do that and ensure that it does happen over the next 5 years?
Yes, I think there is enough will now from both sectors, from private and public sectors, because one outcome of this COVID-19 pandemic has been realization that no one is safe until everyone is safe. So I think everybody realizes that we are in this together, and we must work together to solve for this. So we do see a lot of movement from private sector, from pharmaceutical companies like Pfizer, like Moderna, and others, Serum Institute of India, to work with us, to work with WHO, to do that tech transfer. But it goes beyond tech transfer, as you know, because some of these technologies, mRNA, are pretty complex technologies which require training, which requires workforce training, you know, and building those that infrastructure in a continent like Africa. So I think that's it's still quite a long way away. It will take a few years before we get there. But if we don't start now, I think it will be just getting more and more delayed. So I think the idea for us now is to bring this roadmap together, which we would be announcing on Thursday here in Davos. We have a meeting of all the right stakeholders to look at that roadmap, that how would the financing work, how would the business model work for this, so that you have a facility that can continue to operate during peacetime, but has the capability to surge during the pandemic times and make those vaccines against pandemics.
What kind of investments are we talking about?
Well, I think the capex requirement is not huge. You are looking at somewhere $25 to $50 million.
Okay, that's not big at all.
No, it's not big at all. But the challenge is the business model. We want to make sure that it's sustainable. So you need the operating, so you need the OPEX, you need the operating cost to continuously make sure that the facility is updated and is functioning. So that's the part we need to work on, and there has to be political will. There has to be commitment from development finance banks, from the countries, make sure that the countries and organizations like Gavi and others, they come together and they put some kind of market commitment in place so that there is a strong business model for that. Yeah.
You know, moving away from the pandemic, you've just put out a report which also addresses some of the other challenges that the world is facing. Things like tuberculosis and malaria, etc., which, you know, through the course of the pandemic, nobody talked about because it just completely went off the radar. But these continue to be massive challenges, especially for low-income economies and low-income countries. How concerned are you about the setback on account of the pandemic to dealing with some of these other large issues?
Yes, I think that's a pretty good point. You know, we see that actually Global Fund recently put out a report saying that about 32 low and middle income countries, there was a huge disruption of services for these infectious diseases that you mentioned, TB, tuberculosis, malaria, and HIV. Those health services were badly impacted. In India, India is home of about 30% of tuberculosis patients, are new TBs that are identified. We saw that there was almost 75% drop in diagnosis of new TB cases during pandemic in India. So that these diseases you mentioned, the infectious diseases, were badly impacted. There is a report that there might be more than 1 million deaths because of that, from TB, from malaria. We want to make sure that we come back to that. We make investments there. We make sure the health systems recover quickly. And linked to that is making sure that we prepare for a much more sustainable and resilient health system for the future so that this doesn't happen again. But it definitely has caused many more deaths and many more challenges for TB, malaria, and HIV areas.
Shyam, before I let you go, you know, what is the role that you see India playing in the evolution of the health economy, global health economy? Of course, in terms of vaccine supply, we saw how India stepped up through the partnership that AstraZeneca had with Serum, for instance. But what is the role that you see India playing outside of just providing generic pharmaceuticals or vaccines?
I think India has a huge role to play here. As you just said, in India, the vaccine manufacturing, generic medicine manufacturing has been very strong. India has also been very good in providing cost-effective patient care. And now India is really doing very well in terms of digital health. So in terms of using digital technologies for healthcare. So overall, when you look at all of these things, I think India has the potential to become a powerhouse in healthcare, a global powerhouse in healthcare. So providing from diagnostics to other medical countermeasures, vaccines, drugs, as well as providing value-based healthcare. providing cost-effective patient care. And then one of the things that the forum is working with our stakeholders is to see how we can use breakthrough digital technologies to transform healthcare. You saw the use of telemedicine, but that's just one part. You have artificial intelligence, machine learning being applied in diagnostics, in breast cancer, for example, diagnosis. So we do see that there is a huge opportunity here to use digital technologies to transform healthcare. And with that, you can avoid a lot of fixed costs. You can avoid a lot of traditional infrastructure building because you're using digital technologies. Patients sitting in rural areas, all they need is access to Wi-Fi and a digital device to be able to call their healthcare provider and have that consultation. So that's another area that Forum is working, looking at artificial intelligence, machine learning, metaverse, even virtual reality. How do we use those technologies to transform the overall healthcare? And I see India has a huge role to play there.
Any specific collaborations or partnerships in India to take this forward?
We are working with quite a few companies there in India. You know, Apollo Hospital is obviously one of our members and a company that has been on the forefront. And they will be here. We will be having good conversations with the Indian companies here in Davos. And
including the health minister is going to be here as well.
Exactly. And health minister is in many of our sessions, and I'll be meeting him tomorrow during our healthcare dinner, followed by the policy discussions. So we have the Health Minister of India here. We have many of the pharma and hospital companies from India participating in Davos meetings here, in our healthcare meetings. So we are really looking forward to that.
What is the single biggest hope that you have for Davos 2023? What is it that you would like to get done?
I would like to see a clear-cut roadmap in terms of how do we respond to future pandemics, future emergencies. It goes beyond pandemics. We also look at climate change as a bona fide emergency. So how do we come up with a roadmap to respond to that? How do we make sure that we have a strong, sustainable, resilient health system that can respond to these emergencies, whether it's pandemic or climate change? But at the same time, do not forget the TB patients, don't forget the malaria, don't forget HIV. So I think that's very important here. One other thing I would like to mention here is when we are talking about not forgetting diseases, don't forget non-communicable diseases.
Absolutely.
So NCDs, non-communicable diseases, they are 80% of the disease burden, 90% of deaths. So we want to make sure that we also handle that. And obesity is one area that we are working on. Linked to obesity, as you know, is diabetes, cardiovascular, cancer, and many other disease areas. So that's another angle that we are now tackling now. How do we respond to the NCD burden and the growing challenge from that?
Well, we hope that we see many more breakthroughs in each of these areas, and we certainly hope that there is a greater degree of collaboration in addressing the healthcare crisis that large parts of the world are going through. Shyam, always a pleasure. Many thanks for joining us here in Davos, and thanks very much for your time in this conversation.
Thank you so much, Shereen. Thanks for having me.
Well, we are going to take a break. Don't go anywhere. We continue our coverage live from Davos 2023. We're back in a minute with more.